CEO of the Mental Health Association, and we're thrilled to partner with Frederick County Health Department to bring you this event. During the next hour or so, we plan to share data on the magnitude of suicide in our community and continue reducing the stigma that plagues the topic of suicide. The Mental Health Association builds a strong foundation of emotional wellness for the whole community. And we do that by preparing resilient children, securing vulnerable families, and standing with people to face crises together. Through our work, we strive to make sure that people facing challenging situations, including thoughts of suicide, don't have to face those challenges alone. MHA's 24/7 call center answers quite a few local, state, and national lines for our community, including the National Suicide Prevention Lifeline. When I started at MHA 20 plus years ago, I can remember we answered about 400 calls a year related to suicide, and thinking to myself, wow, just in our community, that's almost or over one call a day. Now we answer a call related to suicide every 4 to 5 hours. In July of 2022, just around the corner, the National Suicide Prevention Lifeline will be available through the easy to remember 3-digit number 988. Because of this shift, we expect the call volume to increase substantially. Unfortunately, that transition didn't come with a dedicated funding stream, so MHA is working with our legislators to ensure that we're able to answer each and every call for help. And with that, I'd like to introduce Melissa Shearer, who is our speaker today. Melissa is the Child and Adolescent Services Coordinator at the Frederick County Health Department's Behavioral Health Division. She has a master's degree in leadership, policy, and advocacy, and has spent her professional years supporting and advocating and connecting developmentally delayed children, adults, and their families to the necessary resources in the community. Since beginning at our local health department, Melissa started assessing suicide prevention and awareness across the lifespan throughout Maryland and within Frederick County. Through this process, she has learned the magnitude of suicide across our state and right here at home. Melissa has also investigated other communities who have successfully developed collaborative, community-based programs to prevent suicide. She's passionate about reducing the stigma that is associated with suicide and engaging our community in honest conversations. I've seen some of the data that Melissa will be presenting, so I know that you'll find this presentation enlightening and informative. And with that, I will turn it over to Melissa.
So I'll go ahead and get started again. Good morning, everyone. And thank you again for being here. Thank you to Shannon and Rebecca for organizing this and putting this together. As this was mentioned, the purpose of this presentation was put together to provide a scope to the magnitude of suicide across the United States, and of course, we want to look at the data that's more relevant to the state of Maryland and within our community here in Frederick. And as we get started, I do want to remind everyone that we will be answering some questions after the presentation. So if you can, please hold your questions or comments to the end or drop them in the chat and Rebecca can relay those to me. So I want to start with the terms associated with suicide and giving clear definitions to the terms associated with suicide. So as you may be aware, suicide is a death that is caused by self-injury with the intent to end one's life. A suicide attempt is when an individual is inflicting harm on themselves with the intent to end their life, but they're unsuccessful in the attempt. And suicide ideation refers to when a person is thinking about or considering or planning for suicide. It is important to note here that the terms committing suicide and successful suicide often carry negative connotations. Avoiding these terms is best in reducing the negative views and stigmatization often associated with suicide. It is better to replace those terms with death by suicide, ended their own life, died by suicide, and or the term suicided. Now, what may lead a person to suicide is not a single event or a factor, but rather it is a multitude of genetic factors, environmental factors, as well as sudden life events. On this slide, this is a list of common risk factors associated with suicide risk that was published with the Centers for Disease Control and Prevention. So as you look at this list, you can see that there are factors associated with environmental factors, genetic factors, as well as, sudden life events like losing a job or suddenly falling on financial hardship. And then, of course, there's, some mental health disorders to be concerned about, anxiety and depression, a history of trauma. I looked at risk factors that were specific to youth and adolescents in addition to this list, and many of these risk factors were associated with adolescents, but some of the sudden events that were specific to that population included things like a bad grade in a class or on a major project, being a victim of bullying or being the perpetrator in bullying, the loss of a parent or a loved one. So quite similar. Now, as we start discussing some of the data related to suicide, I do want to note when the suicide rates, these are based on the number of people who have died by suicide per 100,000 population size. So as you can see, over a 20-year span from 1999 to 2019, the rate of suicide increased 33% nationally. And that equates to 1 death by suicide every 11 minutes. In 2019, suicide was the 10th leading cause of death in the United States. There were nearly 2.5 times as many suicides in the United States as there were homicides. Here is an overview of data that is specific to the veteran population. And this visual was published by the U.S. Department of Veterans Affairs in 2019. And the data contained here, or that is being relayed here, was collected on the veteran population from 2005 to 2017. And in more recent data, I can relate that in 2019, veteran suicides had accounted for over 14% of total suicide deaths throughout the United States. This graph specifically relays information related to the age-adjusted rates of suicide for both males and females. I want to note that the age-adjusted rates of suicide accounts for the differences in population age over time, in addition to changes in the population size during that same time frame. So this all creates a more accurate depiction of the suicide rates during these time frames. So in 2019, the age-adjusted rate of suicide for the male population was more than 3 times greater compared to the rate of females. And although males have higher rates of suicide death, research has demonstrated that females experience depression at approximately twice the rate of men and attempt suicide 3 times as often than males. In reviewing data specific to the veteran population, the age-adjusted rate for suicide was over 35% in 2019. Male veterans accounted for 95% of those deaths. And as you can begin to see, for both veteran and non-veteran suicide deaths, males continue to have much higher rates of suicide in comparison to females. Here in this graph, it demonstrates the rate of suicide in 2019 categorized by both gender and age group. For females, the rates of suicide were highest in the 45 to 64 years age group, and males, it was highest in the 75 years and older age group. And as you look at this graph, you can really see that over the lifespan, males continue to have a higher prevalence of suicide than females. In addition to examining the 2019 suicide deaths by age and gender, the data was further examined by race and ethnicity populations, and this was done to determine the population subgroups that may be most impacted by suicide. The Native American non-Hispanic population were found to have had the highest rates of suicide in both male and females, with males having the highest rates altogether. The white non-Hispanic males population recorded the second highest rate of suicide. Though this graphic demonstrates the rates of suicide by race and by gender, it does not share data related to the LGBTQ population. This is primarily due to the fact that here in the United States, there's no jurisdiction or agency that systematically collects information on either an individual's sexual orientation or their gender identity at the time of death. However, what has been examined in more recent years is the occurrence of suicide ideation and suicide attempts amongst the LGBTQ community. Individuals who identify as lesbian, gay, or bisexual have higher rates of suicide ideation and suicide attempts over their lifetime than those identifying as straight. The transgender community has reported an even greater prevalence of suicide attempts over their lifetime when compared to lesbian, gay, bisexual, and straight individuals. Now, the data on this slide is specific to youth and adolescents between the ages of 10 to 24 years old. So unfortunately, within this age group, suicide is the second leading cause of death across our nation. And this means that more youth and adolescents have died by suicide than the top 17 leading medical causes of death combined. Over a 10-year time span between 2007 and 2017, suicide deaths had increased by 56% within the United States. And here in Maryland, during that same time frame, it had increased by almost 22%. LGBTQ youth are 4 times more likely to seriously consider suicide, to make a plan for suicide, and to attempt suicide. The Trevor Project estimates that at least one LGBTQ youth between the ages of 13 to 24 years attempts suicide every 45 seconds in the United States. And transgender youth are at an elevated risk for suicide attempts when compared to their lesbian, gay, bisexual, and straight peers. In 2019, the CDC had reported in their findings that many youth who have died by suicide had no history of mental health treatment or support services. Now, I wanted to start examining what some of the data was relaying in regards to the impact of the COVID-19 pandemic on youth and adolescent suicide. In June 2021, the Centers for Disease Control and Prevention had published data that was examined over the course of 2020 related to emergency department visits and suspected suicide attempts. The data points collected were compared to the same data points that were collected in the year prior. And the 2020 data demonstrated that there were significant increases in mental health related emergency department visits for children and adolescents. As you can see on the slide, children between the ages of 5 to 11 years old had the increased rate of emergency departments had rose by 24%. And for adolescents, ages 12 to 17 years old, it had increased by 31%. From February to March of this year, 2021, emergency departments were up by 51% for the 12 to 17-year-old age group. In addition to the significant increases in emergency departments for mental health related concerns among children and adolescents, there was also a major increase in ED mental health related visits by girls than boys. The American Academy of Pediatrics, the Children's Hospital Association, and the American Academy of Children and Adolescent Psychiatry declared the mental health crisis among children in the United States as a national emergency in October of this year, noting accelerated rates in depression, anxiety, trauma, suicide ideation, loneliness, etc. among children and adolescents. The president of the American Academy of Child and Adolescent Psychiatry has put emphasis on how this current mental health crisis will have lasting impacts on those affected, their families, their communities, and their collective futures. Unfortunately, more than 140,000 children have lost a parent or grandparent caregiver to COVID-19. The disruptions that children and families have experienced during the pandemic have disproportionately affected children of color. The American Academy of Pediatrics emphasized that the National Emergency Declaration on Children's Mental Health cannot be overlooked, and that proper care to support children and adolescents' mental well-being must be a national priority. Now, as we begin to shift our focus on data that's more specific to Maryland, I wanted to provide a visual snapshot of some of the facts and figures related to suicide across our state. Now, as you're looking at these numbers, I do want you to know that these numbers are based on data that was collected in 2019, because data processing does take about 1 to 2 years. The 2018 annual report from the Office of the Chief Medical Examiner provides data on suicide deaths and methods of lethal means utilized within that year. The annual report is also also includes data from the 2 years prior to recognize any trends and significant differences that may have occurred throughout that time. From 2016 to 2018, there were a total of 1,887 Marylanders who lost their life to suicide. Of those, 65 suicide deaths had occurred here in Frederick County. I do want to point out, and how the data is collected specific to Frederick County, is that data from the Office of the Chief Medical Examiner is only referring to suicide deaths that actually occurred in Frederick County, and does not account for Frederick County residents who may have suicided in another jurisdiction across the state. And looking at the lethal means utilized for suicide, firearms account for 40% of all suicide deaths in 2018. And this trend remains consistent when looking at data within previous years. This is data that was shared from the 2019 Maryland Annual Vital Statistics Report. And as you just look at these little data sets, you can see that in recent years, Frederick County's rate of suicide has been higher than the state's average rate for suicide deaths. This is information that was collected from the Youth Growth Behavior Survey with Frederick County Public Schools. And the most recent report that I could find was the 2018 to 2019 school year. So I just want to go through some of this data with you. For middle school students, there were over 40% of those students had reported being victims of bullying while on school property. And over 22% of students had reported experiencing symptoms of depression for 2 weeks or more. And the survey begins to ask students if they've, to report on things that they may have been experiencing over the course of the last year. And 18% of students within middle school had seriously thought about killing themselves. And over 10% of those students had developed a plan on how they would end their life. And almost 5% of middle school students had reported that they had attempted suicide. When the data for the middle school students was divided by gender, females were found to have had greater numbers, almost double, in each category related to suicidal thoughts, developing a plan for suicide, and attempting suicide. As we look at information or the data that was collected for high school students, I found that over 31% of students had reported experiencing symptoms of depression for 2 weeks or more. And when it got to the section of asking them about their experiences over the last 12 months, 18% of high school students had reported that they had seriously considered attempting suicide. And over 14% of those students had made a plan on how they would attempt suicide. There was no data that was collected on students who may have reported if they actually followed through with attempting suicide. I couldn't find that information on that survey, so I do want to note that I looked for it, but I couldn't find that specific data piece. However, similar to middle school students, as the data was further broken down by gender, female students again had significantly higher rates for considering suicide and developing a plan for suicide than their male peers. This trend seems to continue into the COVID-19 pandemic when looking at mental health related visits to the emergency department during the first year of the COVID-19 pandemic. In 2009, the state of Maryland established a commission on suicide prevention. The commission developed a prevention plan that was submitted and signed by the governor in 2012. Over time, the plan has been modified and updated to become more targeted, focused, and to atone to the goal of zero suicides in Maryland. The plan has been updated in 2020 and has included these new 4 goals: to integrate and coordinate suicide prevention activities across multiple sectors, to develop, implement, and monitor programs that promote mental wellness and prevent suicide and related behaviors, to promote suicide prevention as a core component of healthcare services and promote the adoption of zero suicides as an aspirational goal by healthcare and community support systems that provide services and support to defined patient populations. And lastly, to increase the timeliness and usefulness of surveillance systems relevant to suicide prevention and to improve the ability to collect, analyze, and use this information for action. And there were some examples provided for suicide prevention strategies that are specific to young persons that may include things like preventing and mitigating adverse childhood experiences, strengthening economic supports for families, limiting access to lethal means, training community and school staff members and others to learn signs of suicide risk and how to respond, improving access and delivery of evidence-based care, increasing a young person's social connectedness and coping skills, and following safe messaging by the media and in schools following a suicide. Now, as it was mentioned, I've had the opportunity to connect and talk with neighboring jurisdictions in regards to some of the actions they have implemented or are currently working to implement to address suicide prevention within their communities. Within these next couple of slides is the combined list that I put together of those programs and actions that are happening across Maryland. So many jurisdictions have established a suicide coalition or a suicide prevention work group, and the goals are for them to evaluate current and available services and resources and to potentially establish new strategies to target suicide prevention. Many of the jurisdictions have also developed websites that serve as a central hub for mental well-being and suicide prevention, in addition to finding accessible information on resources that are available within their community. And there was one jurisdiction that I spoke with who is in the process of developing a working partnership with all emergency departments throughout their county to improve suicide prevention across the continuum of care. And they're doing this by little things like providing the crisis hotline information on all discharge paperwork. And additionally, they're working to build a standard follow-up with patients after they've been discharged. And the follow-up services would entail checking in with the patient and to assist in linking them to any necessary follow-up services or helping them make follow-up appointments. In some of the more rural counties I spoke with, there was a heightened focus on the need to reduce access to lethal means. As you can see, if you looked at data across Maryland, there is a higher rates of suicide in more rural counties, and the methods utilized are by firearms. So in those areas, they definitely have recognized that and are looking at ways to mitigate that risk and to keep members within their community safe. And they're doing this by building working relationships with gun shop owners and the gun owner community to work together to promote gun safe storage. And sometimes that can also look like recognizing a friend or a peer that is in distress and you know that they have a gun at home, and just offering to, take that away from them for a couple of days, like through an agreement. But that's something that can be discussed at a later time. That is definitely one of the focuses on a few counties that I've been speaking with, and they've been providing some really good feedback on how those efforts are working together. In other jurisdictions, they're working to develop partnerships with the local school systems to promote suicide awareness and prevention for youth and adolescents. And they're doing this through social media campaigns that are relevant to youth and adolescents. In addition to websites that were designed for the grander community, they were looking at developing websites that were specific to youth and adolescents that would be more user-friendly for them. And in one jurisdiction, they have implemented the Sources of Strength model. The Sources of Strength is an evidence-based model for youth suicide prevention. It's a program that is available through the American Foundation for Suicide Prevention. The program recruits peers through the local school system to participate in the peer leadership program, where the goal is to spread mental health awareness, understand how to help a peer in crisis, and how to identify help-seeking behaviors. The program is designed to model these peer leaders into advocates. And these efforts, although they're still new, the feedback so far is that it has been quite successful. Now I want to kind of shift our focus into resources that are currently available here in Frederick County. As we get started, I would like to take a moment to note here that a couple of years ago, the Local Health Improvement Plan had established a suicide prevention work group and developed an action plan to begin targeting suicide prevention measures within Frederick County. However, due to COVID-19, that work group has not been able to proceed with the intended action plan, as the intended funds were rerouted to support efforts in combating COVID-19. To my knowledge, that work group has remained inactive since that has occurred. Now we have the Mental Health Association of Frederick County. They provide support in numerous ways to our community. Specifically, they have the Behavior Walk-in Clinic and the Virtual Walk-in Clinic, which is open Monday through Friday from 10 a.m. to 10 p.m. and on Saturday and Sundays from 10 a.m. to 6 p.m. The clinic is able to provide crisis services and linkage to appropriate behavioral health providers. They also, as mentioned at the beginning, they have the call center and answers the crisis, they have the crisis hotlines and are able to answer the national, statewide, and Frederick County hotlines. And the callers are experienced and are able to provide support to those who are in crisis and are experiencing suicide ideation. We have Platoon 22 that was established, and that is specifically for veterans within Frederick County and surrounding communities. And the focus here is on veterans who are transitioning out of the military and back into civilian life. Platoon 22 is able to provide a myriad of supports to the veteran population and their families. And one of the supports that they provide is the assistance in navigating the VA healthcare benefits. Frederick County Public Schools has the standard social emotional learning curriculum for all grades K through 12. And in addition to the social emotional learning curriculum, schools have added and are implementing a wellness program that promotes health and mental wellness for both students and staff. There's also staff who are trained in ASSIST, and ASSIST is an evidence-based suicide intervention training. And it provides skills in how to safely intervene with a person who is suicidal and connecting that person to the necessary supports to keep them safe. There are Frederick County Public School staff members who are trainers for this program and provide these trainings to FCPS employees. Trainings have been extended to the Mental Health Association of Frederick County staff as well. And the ASSIST program is focused on intervention and assisting a person who has suicidal thoughts. And the important component to this training is to develop a safety plan with the person and help keep them safe for now. Some other resources we have in Frederick County is Frederick Health Hospice. Frederick Health Hospice is able to provide grief counseling services free of charge to all Frederick County residents in need of support. Additionally, the Frederick Health Hospice funds Camp Jamie, which hosts a few camps each year to support children, adolescents, and their families who are grieving the loss of someone significant in their lives. All of the camps are offered free of cost. We have the Frederick Center that offers many different support groups that are specific to the LGBTQ plus individuals, as well as their loved ones. The Frederick County Health Department has developed the website A Way Forward Together as an online tool for adults and teens to understand common mental health conditions, suicidal behavior, as well as information on resources available within the community. And recently, a virtual calming room was added to this site and offers tools for building resilience for children, adolescents, as well as adults. And please want to note here that this is not exactly an exhaustive list of the supports that are available in Frederick County. There are many others that are not on this list that include On Our Own, the Mental Health Treatment Court, the Frederick Police Department Crisis Car, and the Frederick chapter of the American Foundation for Suicide Prevention, as well as some other resources. As I learned of the many supports our community has in place, I wanted to get an idea on how we can work to strengthen some of our current efforts throughout the community on a community-based approach to suicide prevention in Frederick County. Some of what was mentioned was a targeted focus on increasing awareness of suicide within our community, helping to reduce the stigmas that often plague the topic of suicide, as well as mental health, and to increase knowledge and awareness of resources that are accessible throughout our county. Postvention is an essential pillar to suicide prevention. Postvention is an organized response in the aftermath of a suicide or suicide attempt. And postvention is designed to support the healing through the grief process and or distress caused from a loss, and to mitigate other negative effects associated with an exposure to a suicide death. Some of the other gaps and needs that were mentioned to me was increasing some professional learning for teachers. And this was mainly to provide access to updated resources in regards to mental health, building resiliency, and suicide awareness. And part of those resources that were mentioned were including on how giving tips to general education teachers on how they can relay that information in a meaningful way to their students. It was also mentioned that providing accessible information on available resources specific to youth and adolescents was also a need that has been recognized within the county. And was referenced to an example given that I believe it was about 20 years ago, maybe longer, and this was as reported to me, that students used to be provided like a little information card that had like the suicide prevention hotline on it and some other information regarding resources for mental health and suicide. However, today I understand if we were to roll that same model out again, it's likely that many of the students would just kind of discard that information. And so looking at other ways that would be more meaningful for youth and adolescents to get that information to them was highlighted as a potential need. So to systematically address suicide throughout Frederick County, suicide prevention programs require a comprehensive approach that includes collaborative efforts amongst all community stakeholders. Research continues to emphasize the importance of community partnerships and working together to address the many facets of suicide, from prevention and awareness all the way through postvention and follow-up services. The local Behavioral Health Authority of Frederick County has been able to review and assess all data related to suicide deaths, assess current resources available within our community, and gain insight into the aforementioned gaps and needs pertaining to suicide awareness and prevention resources within our community. It takes time to effectively build these programs and resources, and currently the local behavioral health authority is in the initial stages of formulating targeted actions that are appropriate for the Frederick County community. One of the initial aims, as has been recognized across the community, is really to increase awareness on suicide and really work towards reducing the stigma associated with mental health as well as suicide. As throughout the United States and within Maryland, firearms are the leading cause of deaths by suicide here in Frederick County. Data trends within Frederick County have indicated that suicide rates in more rural areas are actually much higher than the more urban neighborhoods throughout the county. Reducing access to lethal means when a person is experiencing suicidal thoughts is critical in potentially saving their lives. Promoting gun safe storage is one element that can help prevent unsafe use of a firearm. As previously mentioned, the virtual calming room is one recent resource that was added to the website A Way Forward Together. And the purpose of the calming room is to promote mental wellness and to provide tools to the community to enhance one's resiliency. As a community, we can continue to seek out additional opportunities to assist individuals in cultivating resiliency and supporting their mental health. Other aims and actions that we can take on the community level is enhancing the community's knowledge on suicide awareness. And we can do this in a variety of ways. And more specifically, we can help provide workshops and linkage to trainings as well. As already mentioned, the little icon Living Works is in referencing some of the trainings that are already within our community, and they are Safe Talk and Assist. There is Lifeline Workshops that has a workshop called the Ask Workshop, and that is specific to assessing suicide risk in kids. That too is an evidence-based workshop, and I actually am finishing training later today and hopes to become a facilitator for this workshop to make this more accessible within our community. We also have the American Foundation for Suicide Prevention. There is a Frederick County chapter, and they are able to provide numerous trainings, and many of those trainings are offered free of cost. And within those trainings, they're very specific to different communities, populations within our community, I should say. There are trainings specific to first responders, for instance, training specific to mental health providers, training specific to spiritual leaders and clergy members. There's a variety, there's, even for firearm and promoting gun safety. Just a lot of tools and resources are available through the American Foundation for Suicide Prevention. And another focus area is increasing community awareness and plugging information on available resources and making that information easily accessible to the community. Now, I know that this topic can be heavy, so I do want to finish out on a positive note and just remind everyone that there's always hope and that no one could go back and make a brand new start. Anyone can start now and make a brand new ending. And that concludes my presentation.
Thank you so much, Melissa. I mean, just really powerful information. And I think, for so many, it's still that difficult conversation and the stigma associated with it. And is this really happening in our community? And we yet to know the tentacles of COVID, especially on our youth and what they've gone through being in virtual school and losing out on a lot of memorable lifetime moments due to COVID. So I will run through the chat a little bit. If anybody has any question, we have some time. If you'd like to make comments, pay attention to the chat. There's some good information. Shannon had just included that the Surgeon General just this week issued an advisory on youth mental health crisis due to the COVID pandemic. And there's a link to that article in the chat. Let me see. Yes, the PowerPoint, we can make the PowerPoint available. It has been recorded, so we'll be able to send that out and share that with you all as well. Are there any other questions?
Someone asked if there was a speaker in Frederick County for teens or adults to tell their story. I think that was in the chat from Allison Lynch.
I'm sorry.
Yes, so there, Allison Lynch asked, is there a speakers network in Frederick County for teens and adults to tell their stories of recovery and healing from suicide attempts? She said this would really speak to kids and others to hear how others got out of the downward spiral, offering tools and real life strategies for getting beyond this. I know as the development marketing director at MHA, stories are difficult because it is such a difficult topic and it's not very tangible. So I know we are always looking for stories and helping us to share our message and the work that we do here. I don't believe there's a speakers network though.
Not to my knowledge. However, yes, I do recognize the importance of the peer support. That is a key aspect. But to my knowledge, there's not like a speakers group here in Frederick County for specific to youth and adolescents.
Rebecca, do you want to use some of the questions that were submitted
Yes.
with registrations?
Yes, thank you. Thank you for the reminder. So a couple of the questions that came through when people registered, and Melissa, we didn't touch on the senior population, but do you know if there's a rise in the senior population here in the county?
So what I can relay is the data within the presentation did highlight that when the data was divided by gender and age and ethnicity, males, white males 75 years or older did have some of the higher rates of suicide, but that was on a national level. So I haven't been able to really get my hands on, due to some legalities, of the data specific to Frederick County population and how that data has further been divided. So I can't speak to the specifics on where we're seeing the increases on the older populations, but just the general data of what we're seeing and what methods are being utilized.
Thank you for that. And you mentioned non-English speaking communities. The question is, how do you handle suicide among non-English speaking communities? I guess that's getting them access to resources in the community.
Yes, and through the lens of training and providing support and resources, the American Foundation for Suicide Prevention does have information that is specific to Spanish-speaking communities as well.
Great. And is there something that we're doing as a community to teach parents about warning signs?
To my knowledge, there is not an organized program or mission that is specific to educating parents. I think it can happen through conversations, and if children or adolescents are linked to mental health providers, it's possible that those counselors are providing insight into what that looks like to the parents. It is my understanding that, as the stigma is pretty far and wide with the topic of suicide, and trying to engage parents in looking at signs and recognizing what that might look in their child is very contentious. But my hope is to improve that and, make that information on risk factors, more accessible to the community, so we can, work together to really strengthen that.
And I think just by the numbers on this call, I mean, this was the hope, the intent to start the conversation. It is a difficult conversation to have, and pull in our stakeholders here in the community to continue the conversation. So this is the start, right? Let's talk about it. Let's bring those people in that have the leadership ability to make change, and provide those programs, not only in our school system, but in the community and other organizations. Let's see, any other questions? There was a comment. Certainly, we've all been made aware of the school shooting incident in Michigan, and the concern for that student crying out for help. And it says, what can the school system do to help students with mental health issues such as depression and suicide ideation? The difficulty is we don't have a representative from the school system that can speak on that. I don't believe we do. But is there anything that you know that the school system's doing?
Well, I'm not sure how many may be aware, but there are a lot of mental health workers within the school system that are hired through FCPS to provide support to the student body. And, you know, they are available too through teacher referral. If a teacher is recognizing, you know, some concerns for a student, they can reach out to either the social worker or the child and adolescent services worker within the schools. So there are mental health supports that are built into the Frederick County school system, but I can't speak to, you know, how they're mitigating that on a day-to-day basis within the schools. I think one of the actions is just the assist training, and that helps staff to become more aware of warning flags and risk factors to kind of be mindful of, and to recognize when a student may be, you know, acting out in a behavioral manner, but in a way that they can be like, this is a little concerning, and I want to connect them to, you know, the counselor at school to help support that student.
And I know here at MHA, we have a very good relationship with FCPS in doing training with their staff. We sent some people out in August to work with some of their staff to give them an overview of the resources we have here. They're often reaching out to us and including us in wellness open houses that they're doing within the schools, providing them with resources about walk-in in our call center as well. So hopefully that continues, and we continue to let parents know of the resources available in the community.
The social emotional learning curriculum that FCPS is adding, or is offering, has been added within the past, I would say, 3 years, and kind of rolled out to all ages. So, you know, that's relatively new. And like Melissa said, they have added a significant number of behavioral health staff to their ranks over the past probably 2 years.
Lots of good, thank you, Shannon. Lots of good information coming up in the chat. Vicki says FCPS has assist training for school system employees. Is there a possibility for this training or something similar to be offered to interested parents?
MHA also offers assist training. So if folks want to contact us, we could certainly offer it.
Anything else?
It's Sonia, Rob. I have a comment. The school is doing a great job reaching out to the parent when you have teenagers that are going through, you know, life issues. But what I've experienced is that there is a breakdown between actually getting the help that you need. That has been really slow or never happening. So if someone, again, based on experience, if someone is going to hurt themselves, currently I don't see anything preventing that. So that's an issue for the community. I mean, I hear there are a lot of resources, but for the actions to actually happen, it's really slow or never happen. So I'm not sure who to reach out to. For instance, if you have to give referral for a mental health therapist, that referral takes really long, and you may have a copay based on your insurance for like $45 per session. You may not have. You can go to the doctor free, but you have to pay $45 to talk to a therapist. You understand what I'm saying?
So Sonia, one of the reasons that Mental Health Association started our behavioral health walk-in clinic was to address some of those issues that you're talking about. And I think that that would be a great place to seek guidance and assistance. Like Melissa said in her conversation, we're open 10 to 10 Monday through Friday, 10 to 6 on the weekends. And we can certainly help link you to future behavioral health ongoing counseling. And, you know, we really work hard to make sure that payment is not a barrier to somebody that needs treatment.
Okay. Okay. Thank you.
You're very welcome.
If I could add to that, Shannon, for walk-in as well, Sonia, what we're able to do is the follow-up piece, right? So even after coming in and meeting with our crisis specialist in the beginning, we offer follow-up to help ensure those connections to that next level of service. And you are absolutely right. It can take a while. Payment can be an issue, but we're kind of here to help you help you through that process, and to do as much as we can so that you're not kind of trying to navigate all that all by yourself.
Sorry. Okay. All right. Thank you.
Thank you, Susie. Anything else?
Hi,
Okay.
this is Jennifer. I just want to let folks know if you, SAMSA has a lot of free information, brochures, and little wallet-sized cards that are in Spanish and English on spotting the signs of suicide, recognizing it, and also on tips for coping. That's free to anyone that you can have in your lobby or in your office that you can request for free. So if you go to their website, you can look at all the resources they have available for free, and they will mail it to you for free.
What was the website again, please?
It's in the chat. I've put a few in the chat to some links. So it's the SAMSA website. It's the Substance Abuse and Mental Health Services Administration. So if you click on it, you can check out all of the literature, and everything is free.
Thank you, Jennifer.
Hi, this is Pilar Olivo. I'm the ACEs liaison with the Frederick County Office for Children and Families. And I did want to mention that the ACEs work group shared a statistical analysis of the intersection between the youth risk behavior survey data and ACEs, which there are 4 ACEs questions which were included in the 2018 survey that you mentioned. And the protective factors that emerged from that statistical analysis did show that 3 caring adults in a student's life did reduce the risk of suicide planning, as well as other risk behaviors. So as a result of that specific survey, FCPS did implement an effort with certain students to put three caring adults in their lives to make sure that they were trying to connect with at least 3 caring adults. So I did want to mention that. And the next youth risk behavior survey, which is being in the field right now, and the results will be available in 18 months to maybe 2 years, do include more ACEs questions and more protective factors questions. So hopefully we'll have more local data to be able to follow up on.
Thank you, Pilar. Appreciate that information. There's a lot of good work happening in the community. It's just important for us to share that so we know what's out there in the community. So thank you for that. Diane mentioned in the chat that Trinity Pastoral Counseling Center operates on a sliding scale. They currently serve adults with any or no faith, background, and specialize in aging. So for those that were asking about the senior population, Medicare is a problem. They have a licensed LCPC staff, but Medicare doesn't accept that license, which is a little frustrating with this disparity. So know that that's available for our senior population out there. Anything else? It is 9:02. Want to give one more minute to, if there's anything else anybody wants to share. Melissa, we are so grateful for you and your research here in the community, and thank you for sharing it with us this morning. Again, this is the start of the conversation, and so what we need to do is continue it and pull those stakeholders, the community leaders in to continue the conversation and continue to fight to that 0 suicide rate here in our community. Again, great resources in the community. Please visit fcmha.org to learn more about the Mental Health Association and all the resources we have available. We're here to help. That is our goal. Anything else? I will make sure everybody gets a copy of the recording as well as the slides. We'll send that information out as well. Please don't hesitate to reach out if you have any additional questions. We can pass those on to Melissa as well.
Thank you so much, Rebecca.
Thank you. Appreciate everybody being here so early this morning. Have a wonderful holiday season. Stay warm. And again, thank you for being with us.